Politics can be very toxic in our society and the way it's portrayed on social media.
That's why I welcome you to The Nature of Politics, where every week we break down some of the biggest topics. No shouting, no noise, just facts, and a place to think. In this 7-part episode throughout this week, I'm going to be going over the One Big Beautiful Bill in the Senate's final version, so we can see how it truly impacts you. As it's 1,000 pages, so there's so much to go over. On Monday, or today, we're going to be going over Medicaid. So, let's dive into it. Welcome everyone to The Nature of Politics. Today we're going to be going over Medicaid, but first we are in this beautiful, serene environment. So let's take a quick deep breath, wash away all the worries that we've been seeing in the news about politics and social media or anything like that. And let's just bring this all together, talk about the finite details of Medicaid, where I'm not going to judge you for your opinion, but also give you some questions to ponder about. So over 7.8 million Americans are expected to lose coverage, Medicaid coverage, due to the Big Beautiful Bill. This is by 2034. And Medicaid, what is Medicaid? Medicaid is the public health insurance program for low-income Americans, which includes seniors, people with disabilities, and many children. The bill proposes some of the largest cuts and changes to Medicaid in recent history. The Congressional Budget Office, which is a nonpartisan organization that helps Congress see how their legislation and bills will impact Americans. They rely just on numbers and facts. Say that cumulative cuts would be approximately $793 billion on Medicaid by 2034. So let's see if you're a part of those numbers. One big change is the work requirement. So if you are ages 19 to 64, you need to work at least 20 hours a week or 80 hours a month on either a job, educational training, job training, volunteering, and that also applies if you have a child that is above 14. So if you have a child or a dependent that is below 14, this does not apply to you. And here are some other exceptions as well. If you are pregnant, elderly, disabled, medically frail, in treatment, or again caring for dependents, but the burden of providing that proof falls on the enrollee. So you have to provide your proof on your own. The government's not going to help you on that, and you have to make sure it's accurate because they will check. This bill also tightens immigration-related eligibility rules. So anyone applying for Medicaid or CHIP, Children's Health Insurance Program, you must be a legal U.S. citizen or have legal immigration status. And you must provide this in a limited time frame. If you can't, the federal government won't help you cover your medical costs. States can now also provide temporary coverage and refuse this coverage while you're waiting for your documents. So say you are waiting for your legal immigration documents, the states can say, no, we aren't going to cover you while you're waiting for those documents for any Medicaid costs. Something many states currently do, but they are expanding this. The House proposed penalizing states for using their own money to provide care to undocumented immigrants by cutting federal funding, but the Senate did reject this. So the Senate parliamentarian rejected this because it did not follow the Byrd rule, removing the penalty. The House tried to eliminate a long-standing financial method where states would tax healthcare providers in their states to draw more federal funding for the program, but the Senate did remove this provision, saying it would really hurt rural hospitals. So this saved about $250 billion, and they're also setting up a fund to help these rural hospitals as well. The bill provides repeals extra funding for programs that help seniors and disabled people live in their homes instead of nursing homes. It also halts enforcement of staffing standards in these nursing homes by about until 2035. They will most likely start enforcing those again, whatever another bill will propose. But this means nursing homes won't be required to have a certain amount of nurses or aides on duty. This could impact some people's care. Another key change is retroactive coverage. So currently, Medicaid will cover your costs 3 months prior to you applying. So if you had some big medical emergency and you've been in the hospital for a long time and now you need help covering these costs, Medicaid would cover it up to 3 months. This bill brings it down to 1 month. So only 1 month from your application date to, that 1 month period. So make sure you are applying early if you think you're going to be needing it. I know it's hard sometimes if it's emergency, but that is unfortunately what the bill is saying. This bill also ramps up efforts to detect fraud and improper payments, so helping make sure that the money in Medicaid is actually being spent on people that need it and detecting fraud. There's a lot of already in place procedures for this, but they're adding more, such as making sure that deceased enrollees are not on the payroll anymore. And states, and the big one for you guys is states must review eligibility twice a year instead of once now. So many enrollees might get kicked off health care and Medicaid more often. So make sure you are meeting those requirements throughout the entire year. This bill also removes the federal good faith waiver that previously allowed states to avoid penalties for eligibility errors. So states would say, hey, we tried our best. Can you still give us our funding? Now, if a state keeps ineligible people or enrollees on the rolls, they'll lose a portion of their federal funding, and there's no exceptions for this. The bill also imposes mandatory copays for Medicaid expansion adults who make just over the poverty line. So starting in 2028, this group will be required to pay out-of-pocket costs for some services, so not all, I'll go into those in a second, but with copays capped at about $35 per visit. So the things that are an exception are primary care, mental health, and emergency services. These will all remain free, but for everything else, enrollees must be charged at the time of care. And this also gives leeway to the providers to say, hey, if you can't provide this payment in person, they can actually refuse service. And expansion enrollees, they will also not have to be charged premiums as well. That is also in this. So even with all these rollbacks, the biggest groups are still the same. These at-risk groups are still the same. Low income, working adults without dependents. If you have dependents, again, you still have some leeway with that. People with unstable jobs and inconsistent documentation. So make sure that you are having documented proof of your work, pay stubs, volunteer hours. Make sure that you have, if you have a transcript, you're going to college, something like that. And expansion enrollees who will face new copays. So for me, the key takeaway is this. The Senate trimmed most of the big edges of this bill from the House, but the heart of it is still untouched. Massive structural changes will be made to the way care is provided, who gets access to that care, and who pays for that care. If passed, this legislation would mark one of the biggest changes to Medicaid in recent history, fundamentally redefining the role of public health insurance in America. So these are some of the big questions I want you to ask yourself. Talk with your family, online, friends, or even in the comments here on YouTube. So who should bear the cost for when someone can't afford care? Patients, hospitals, the government? When someone, has cancer out of the blue, who should be paying for that? Should that person be paying for it even though they didn't expect this? Because this kind of goes back to the biggest debate in healthcare. Is healthcare a human right? Does it tie back to our natural rights as a human to lead a healthy life? So think about that one. And also, should work be a requirement for access to healthcare? So does someone have to work 20 hours a week to get healthcare? And should states be punished for using their own funds to provide care for undocumented immigrants? This was struck down by the Senate, but it could be something in the future that we'd see again brought up. So, talk about that as well. So these are the big three questions, and come up with more questions that you can maybe ask in the comments, but give your answer in the comments, talk with friends and family. But that's all I have for Medicaid. I hope you enjoyed. If you have any questions, you can give me an email, nwardolph@icloud.com, or DM me on my Instagram at Nathaniel Rudolph. And, ask me questions. I've read this bill forward and back, all 1,000 pages, and I've analyzed everything. So if you have questions or, something wasn't clear in here, feel free to, contact me. Thank you for joining us, and I'll be back tomorrow with our next topic.